friends, this is V's Medicine Diaries. In this video, we are going to focus on myositis ossificans. Okay, so let's go to the video without wasting any more time. But at the same time, please share, support, and subscribe to my channel. So, what do you mean by myositis ossificans? Okay, as the name indicates, something is being ossified. What is the one which is ossified? It is nothing but it is the ossification of hematoma which is formed around a joint, and this results in the formation of a mass of bone tissue, okay, mass of bone which restrict that joint movement. Okay, it is the ossification of hematoma around the joint, okay, and resulting in the formation of some bone which restricts the movement of the joint either partially or completely. Okay, now let's see the causes of this myositis ossificans. Myositis ossificans is otherwise called as post-traumatic ossification. So the most common cause is trauma. Okay, trauma to the joints. Usually it occurs as complications of fractures, especially supracondylar fractures. Okay, supracondylar fractures of humerus. And so it is very much common in elbow joint. Okay, it is followed by hip joint. So what is this trauma? Okay, what is the extent of trauma? This trauma to the joints usually result in the stripping away of capsule or the periosteum from the bone, and this in turn causes the myositis ossificans or the pathological changes towards the myositis ossificans. And another important factor causing this myositis ossificans is nothing but massage. Okay, massage over the bones or over the muscles, etc., following usually some fractures can cause this myositis ossificans. Okay. And other causes of this myositis ossificans include it is seen in patients with paraplegia or in patients with the prolonged or permanent neuronal damages. Okay, in usually after head injury and all. And these are the other causes of our myositis ossificans. Okay, mainly trauma and massage. And now let's come to the complications of this myositis ossificans. Okay, so what are the complications? Of course, it can restrict the joint movement. Okay, it can restrict the joint movement, and that is the most important complication. And when the bone mass, okay, when the newly formed bone mass is bridging the joint, okay, then it can cause extra-articular ankylosis. Okay, it is another complication of myositis ossificans. And also, there is another rare complication that is nothing but myositis ossificans progressiva. Okay, it's a form of fibrodysplasia, and it is usually seen in children less than 6 years of age. And the most common cause of death in those individuals is lung damage. Okay, it's just an add-on information. So these are the complications. Now let's see what are the investigations. Main investigation: X-ray. Okay, X-ray of the elbow joint, and we can see a bone mass or a bone mass in this region. And another important point radiologically is that radiologically it is of two types. Okay, myositis ossificans is of two types. That is active myositis as well as mature myositis. Active myositis means the bony mass, okay, is having fluffy margins, while in the mature stage, okay, in mature myositis ossificans, the bone mass is more trabeculated and having well-defined margins. Okay, usually in a single myositis ossificans, there will be mature bone as well as immature bone, and this mature bone is seen towards the periphery, while the immature bone is seen towards the center. Now let's see the treatment for myositis ossificans. Firstly, in the active stages of the disease, we treat it by stopping the massage. Okay, if there is any massage process and all, then stop that massage and give complete rest as well as NSAIDs. Example, indomethacin. Okay, we give NSAIDs to inhibit this process of or this progress of myositis ossificans. And in late stages of the treatment, we advise active physiotherapy. Active physiotherapy means the patient himself or herself has to do the physiotherapy. Okay, passive physiotherapy is a form of massage. Okay, we are the physiotherapist or the doctor is doing that. Okay, but that is not favorable in this condition. What is favorable or what is advised here is nothing but active physiotherapy. Also, if the joint movement is not restored after about a few months or year or just in 1 year, then we can surgically excise the mass, okay, for the proper movement of the joint. So that's all about myositis ossificans, and if you have understood the topic very clearly, please like my video and also share it with your friends, and also please comment your suggestions in the comment box. Have a positive mind, positive vibes, positive life, keep smiling, live happy. Thank you for watching.